the most challenging thing that we've experienced with Josh, just probably from day one, is the lack of communication, his being nonverbal. He does have a communication device, so we do have that way of connecting with him and giving him a voice to be able to connect with us. But because of those delays in language, we have found that using pictures or other types of visuals have really kind of helped us support him in his day, as well as give him an opportunity to tell us if something's bothering him almost immediately. So there might be a picture of help, or there might be a picture of, I want, food, I want this. And so he's able to quickly grab those pictures or use his communication device to communicate with us. So having those visuals for him has been key in being able to carry on conversations and help his day be less challenging for him.
He'll take something that you said, because his mind like a steel trap. He just remembers so much. So you'll go to explain something to him, why he shouldn't do a certain thing or hold on to a certain thought, and you go to explain that to him. He will come back with a statement or a question and shows where you really contradicted yourself. The challenge is that he'll take something from another situation and I call it the saran wrap effect, where he just kind of stretches and pulls it over every situation as if this answer is now universal. And like, well, no, it's not universal. It's not applicable in this matter here because of these particulars right here.
We do still have challenges. He's still autistic, even though he's 20 years old. It's become such a part of our life, it's kind of the norm, so we don't even think of it like that. But just the literal thinking, it leads to a lot of confusion. When you're talking about something, if you have plans for something and they get changed, he's better. He's much, much better than when he was younger, but he still has a reaction, well, you said we were gonna do this, and that's a lie. And like, no, that's not a lie. Things change, but just being honest, being open. Even talking to him, he's an adult now, essentially, about that mommy does make mistakes. I'm not perfect, I don't know everything, so things are gonna change, but just being honest.
So with Henry's transition to middle school, one of the things that we're dealing with as a 15-year-old boy are his issues surrounding puberty, as well as some increased OCD tendencies. Henry has a need to repeat certain activities over and over again. And once again, that comes back to that patience part, so that we're very patient when we're trying to get in and out of situations, in and out of the house, in and out of the car. Those are things that we deal with on a daily basis. Patience certainly helps. We also need to understand that this is not Henry trying to be difficult. He's really just trying to feed the need for his OCD activities. So it's important that we keep that in mind so that we don't get frustrated and make that situation go poorly.
There has been a lot of struggles with helping her understand the importance of certain things that are just basic needs: toileting, brushing your teeth, brushing your hair, some of those morning routines, getting ready for school, evening routines, getting ready for bed. Some of those have been difficult with her, not because she doesn't seem to have the physical capacity to do it. It just seems like we haven't been able to make clear to her yet why this is something that's so important for her to be able to do. Some things that have helped with that are us attaching it to other things that she does find important. It's not uncommon for her to get up in the morning and the first thing that she says to us is, go to school, see my friends. And yeah, you are going to go to school today, you are going to see your friends, but here are some things that we have to do first before you can go to school. And so that really helps with when we can attach those things to things that she's already familiar with and already engaged with.
Even now with the transitioning from free time to time to get in the shower, to get ready for bed, I make it playful so he knows. Our motion, it's time to take a shower, and then we sing to each other, we go back and forth, and that makes the transition somewhat easier.
I think the biggest challenge that we have right now is getting him to transition from one thing to the other. He likes to spend a lot of time on the computer, or a lot of time playing PlayStation games and not necessarily doing the things that are more constructive for him. So we use a timer at home a lot.
When Isaac was diagnosed, I was 15. So around that time, you're talking on the phone with your friends. You're always trying to hang out with someone. And sometimes friends would not understand, hey, what's that noise in the background? Or why is it so loud in your house? That's my brother, and that's the way that he expresses himself. So for me, this is a total package. This is what comes with my friendship, with the relationship with me. My brother's a part of that. So he may be a little loud. He may be singing in the background or doing sound effects to a game that he's playing. That's just what goes along with it, and that's what you have to deal with it. If not, I don't come with it.